Welcome back into Everyday Kentucky. We're here in Georgetown with Dr. Srikanth Nithyanandam, who is the team physician. He's in charge of all the medical for Georgetown College Athletics. And Doctor, first of all, you're a primary sports medicine practicing physician. What does that mean?
So basically, in sports medicine, we have two types. We have an orthopedic sports medicine, and we have a primary care sports medicine. So basically, I'm a board certified in family medicine and then sports medicine. So I have a unique advantage of taking care of both medical problems as well as orthopedic complaints, but basically non-surgical. So I'm not going to do any surgeries.
Okay, gotcha. I know one of the things that you have here is the ultrasound. How important is ultrasound in sports medicine?
I think the ultrasound has kind of changed how we practice sports medicine nowadays. So think about more as ultrasound is more like kind of an extension of your clinical hands, basically.
Sure.
So for example, let's say I have some concern that this person might have like a quad tear or something of the muscle tear, then the ultrasound can help me prognosticate how much time it takes for him to get back into field and things like that.
Gotcha. I would think that relationship with these patients is very important. Because for the first time, these young athletes are away from their parents, they're away from their family doctor, and if they're seeing you, that means something's not always right.
That's true. And I think in Georgetown College, we have a pretty big team, and athletic trainers pretty much serve as their first point contact.
That's right, sure.
And then the athletic trainers serve as my contact. So fortunately, we have a really great team in Georgetown College, and the athletic trainers makes these kids feel welcomed, and this way it makes my job easier too.
Dr. Sri, it's not only Georgetown College, that's a primary focus for you, but here in Georgetown, they have all kinds of great athletic programs, not only at the high school level with Scott County and Great Crossing, but all the youth programs. And I think it's really neat that you have a walk-in clinic. People can just come anytime. Tell us about that.
The goal of the walk-in clinic is to have a timely access to injury evaluation.
Sure.
And I think that's really important from an injury perspective, is because sometimes a timely evaluation may end up needing a timely fixation that can actually change the prognosis of an injury.
Sure.
For example, like last week I saw a person who actually tore his distal biceps.
Oh my God.
And because of that, because of the walk-in clinic, he was able to come right away, and we confirmed with an ultrasound that he has a tear, and then he was able to get fixed within a couple of days or so.
Oh my God.
So let's say if he hasn't had a walk-in clinic like this,
right,
he probably would have waited for 1 or 2 weeks, and that would have changed the prognosis of the injury. Unfortunately, patients cannot make the decision between which one is urgent and which one is not.
Good point.
And that's the hope, is like with the walk-ins, they don't have any barriers so that they can be seen right away.
Dr. Sri, the other thing too is there are a lot of people like me that still think they're athletes, and so you see a lot of those here, and those folks can come and walk right in as well.
That's correct. So whenever we see an athlete, it doesn't always have to be competitive. Even a recreational athlete, even someone who's trying to lose weight to help take care of the diabetes and stuff,
sure,
still can be a part of the, just come to the walk-in clinic to take care of their injuries.
Absolutely. Dr. Sri, a lot of people do know I'm a Georgetown grad, and folks speak so highly of you. Thank you so much. It's great to spend the time with us.
Same here.
And we'll see you next time on Everyday Kentucky.